Casey Griffis, and the nursing care delivery that I chose to go over with you today is total patient care. Total patient care is continuous nursing care along with total accountability for your patient. This is my patient, Lucia Gary. She is my grandmother and was diagnosed with renal failure approximately 1 year ago. Doctors prescribed her diuretics along with peritoneal dialysis. Peritoneal dialysis is the process which waste are removed from the blood when your kidneys are no longer able to do so. Her medical history includes hypertension, aortic stenosis, and anemia. Peritoneal dialysis was the best option for her due to her aortic stenosis. It is less aggressive on the heart. This process is performed on her every night and takes approximately 4 hours. Before and after each treatment, her vitals are taken. This includes her blood pressure, respiratory rate, temperature, along with her weight. Weight is actually the best indicator if she is retaining fluid. Advantages of total patient care include being familiar with her baseline, being familiar with her medical history, being able to monitor her daily progress, being able to make sure that her medication regimen is followed, as well as her diet. Her diet includes a high protein, low sodium, and low potassium diet. The most important advantage for her personally is that she's in the comfort of her own home rather than going to a dialysis center 3 times a week. Some disadvantages of total patient care include not having an on-site healthcare team, not being able to have the hospital setting and supplies, for example, being able to take her labs. Labs are important in a renal failure patient because it is important to monitor their albumin, their creatinine, their BUN, their hemoglobin, and hematocrit. Very important in peritoneal dialysis patients is to monitor for infection. In the process of placing the catheter, it's a surgical procedure where the catheter is placed through her abdomen into the peritoneum cavity, meaning that there is a catheter which is visible through the outside and is a site for a risk for infection. Each day before her procedure, I check the site to make sure there's no redness, swelling, tenderness, and also check her temperature just to make sure that it's not elevated, which can mean risk for infection. This is important for her, and overall, she feels more comfortable in the comfort of her own home, and yet still goes to her physician visits to monitor her progress. This is the end of my presentation, and I hope you enjoyed. Thank you.